Hi, I'm Tom Carisi from the Dynamics 365 Fast Track team. Welcome to this customer onboarding tech talk for Microsoft Cloud for Healthcare. Microsoft Cloud for Healthcare Tech Talk Agenda. We'll start by addressing what is the Microsoft Cloud for Healthcare in the introduction section. We'll then take a closer look at the solutions overview and then dive deeper into what each solution is, i.e. care coordination, personalized care, patient insights, virtual health. We'll then discuss data interoperability, and then we'll have a look at how you'll get started. The attendees for this is likely to be key stakeholders from the customer and partner teams, solution architectures, functional and technical leads, and BAs. The requirements for this is to understand a baseline of Azure, Power Platform, and Dynamics 365. Introduction. What is Microsoft Cloud for Healthcare? Microsoft Cloud for Healthcare brings together trusted and integrated capabilities for customers and partners to enrich patient engagement and connects health teams to help improve collaboration, decision-making, and operational efficiencies. Microsoft Cloud for Healthcare makes it faster and easier to provide more efficient healthcare and help ensure the end-to-end security, compliance, and accessibility of health data. The Microsoft Cloud for Healthcare extends capabilities that deliver automation and efficiency on high-value workflows, as well as deep data analysis capabilities for both structured and unstructured data that enables customers to turn insight into action. The Microsoft Cloud for Healthcare will support accelerated health transformation into the future, with capabilities for customers and partners spanning the most important needs for healthcare organizations. Enhance patient engagement by allowing them to get a complete view of their patients and create individualized patient experience. Empower team collaboration by making it faster, easier, and more secure to coordinate care, collaborate, and generate that 360-degree view of their patient across the care system. Finally, our customers can unlock powerful insight with limitless analytics. They can translate them into concrete business decisions and actions to ensure that insight become actions. And also it triggers automated workflows based on patient or staff actions and predictive analytics. And it's all built on a trusted platform with unmatched security and privacy. Let's look at these capabilities in a bit more detail. Cloud for Health includes better experiences via building better relationships, transforming data into prospective insights, and tailoring new avenues for care such as virtual health. It delivers better care through care team collaboration by optimizing resources and solving problems collectively. Care coordination enables system of engagement with intelligent workflows. Continuous patient monitoring combines IoT and analytics to optimize treatments. Better Insights brings together multiple systems of record which can be used for optional analytics to gain actionable insights. Solutions and base requirements. Depending on the healthcare scenario that you wish to take advantage of and the capability you wish to deploy, you would need to have the base requirements deployed inside Power Platform, Microsoft Dynamics 365, and Microsoft Azure. For example, if you wanted to take advantage of patient outreach or patient access, you would need to have deployed Power Apps, Power Automate, Power BI. From Dynamics 365, you would need to have marketing and customer insights, and from Microsoft Azure, you would need to deploy API for Fire and HealthBot. Each of these components would need to be licensed separately. Care coordination. In this chapter, we're going to take a closer look at all the capabilities included in care coordination. Let's take a moment to review the high-level reference architecture for care coordination with care management and home health. In the overall architecture for Microsoft Cloud for Healthcare, the Azure API and Fire together with the Azure Fire Sync agent enables organizations that uses data models based on the fast healthcare interpretability resources standards frameworks to simplify data synchronization between Azure and Microsoft Dataverse, powered by the Microsoft Cloud for Healthcare solutions in the Power Platform. Our Microsoft Cloud for Healthcare business applications are built upon existing Microsoft technologies, leveraging the Healthcare Common Data Model. Care management leverages Power Apps model-driven applications, and home health is leveraging Dynamics 365 field service capabilities. Other Microsoft technologies can be leveraged to enhance your solution, such as patient surveys via Dynamics 365 Customer Voice and patient insights via Dynamics 365 Customer Insights. Now, let's look at the key components for care coordination on the next slides. Care management. Concisely communicate the right information at the right time to the right people to provide coordinated care to the patient. Easily create, personalize, and enable new care plans for patients, and also manage care team members. Some of the key capabilities for care management include patient health analytics. In the health analytics area, the Care Coordinator dashboard is a template for viewing care plans, specific appointments, and personalized timeline. Patient care provider and clinics. Management of patients and practitioners. The patient care plan and care team. Create and assign care plans and automate adherence to improve care coordination for your patients. Care team area lists the associated medical professionals, family members, and other authorized people involved in the patient care at the role of the care team. Patient appointments and clinical timeline. Create and manage patient appointments and use clinical timeline to monitor and plan patient events. The clinical timeline offers concise, sequential, and interactive view of patients' clinical occurrences. Patient clinical data management. Within the clinical data category, create and manage patient observations, care plan activities, patient procedures, and appointments. Care management is built on a model-driven app on top of the Power Platform to provide healthcare-specific capabilities as part of Microsoft Cloud for Healthcare. Let's take a closer look at health analytics. On the right-hand side, you can see some screenshots of how some of the out-of-the-box dashboards appear. Care management. So within the health analytics area, the Care Coordinator dashboard is a template for viewing care plan specifics, appointments, and a timeline. This provides a view for the care coordinator to understand their patient's requirements and also be able to provide updates via email, phone, or Teams. The care plan management view also gives an enable of all the care plan activities, appointments, and timelines for patients. These are filterable by patient or care team members and also date range to allow easier navigation. Patient and practitioners. In the people area, you can filter your view to see active patients or active practitioners, amongst others. When listing patients, select the patient and select Edit. The patient form provides basic information and links to the patient's clinical data, the care team, and the healthcare activity timeline. You can customize this form to suit your patient care practices. From the patient form, you can select the Related tab to select the related activity or category to add this tab to the form. Patient care team. Select the care team tab for a view of the medical professionals, family members, and other authorized people involved in the patient's care, including their names, role, and the care team, as well as the associated care plan and condition. This again provides clear, concise view of the care team for a care coordinator and provides the means to communicate via email, phone, or Teams in the context of a patient. Care plans. Care plans allow care providers to provide distinct actions that both patients and caregivers can perform in order to proactively help a patient achieve health goals. The Care Plan tool within Microsoft Cloud for Healthcare provides users with the ability to add care plans as well as accompanying activities and goals to a patient record, as seen in the screenshot below. From within a care plan, as you can see in the screenshot above, you can add activities and the associated goals to the individual care plan. You can also select a care plan template, which allows you to use certain default portions of the care plan and the associated activities and goals. Patient timeline view. The clinical timeline gives the ability to view patient clinical occurrences over a wide period and the care specifics via a built-in timeline control. This also gives the ability through the timeline to dive into the underlying specifics of the clinical event. This provides care coordinator the ability to view clinical events in a sequential fashion for the purposes of understanding what events have taken place to discern what should be the next plan of action and or avoid duplication. Typical activities inside the timeline would include medication requests, procedures, conditions, or encounter. Medical identifiers and patient merge. As part of the feature, as you can see below in the screenshot for the contact record, you will see the multiple medical identifiers. You can use multiple medical identifiers like medical record number or driving license to identify who the patient is. In the screenshot on the right, you will again see the contact record and you will have the ability to merge the record with the agent via sync. Patient encounters. An interaction between a patient and a healthcare provider for the purpose of providing healthcare services or assessing the health status of a patient. From the screenshot on the right, you can see the encounter record. Here you can capture things such as the encounter number, the administration number, the subject of the encounter, the start and end time of the encounter, as well as things like specific clarification of what the encounter was in terms of the class. And you can also customize this and add new fields, remove fields, and customize the form to your needs. Care Management Care Coordinator gets to view patient encounter details with associated care plan care team assigned work to the patient. Procedures information. A procedure is an activity that is performed on with or for a patient as part of the provision of care. Example would include surgical procedures or diagnostics procedures. On the right-hand side here, you can see an example of a procedure record with the selected fields filled in for this particular procedure. You will see that it will have an encounter type and an episode of care, as well as a location. Obviously, this will link through to the patient and also have the procedure ID. Again, you can fully customize this and add additional fields where necessary. Patient observation information. Observations are a central element in healthcare, used to support diagnosis, monitor progress, determine baseline and patterns, and even capture demographic characteristics. Care Management Care Coordinators gets to view patient observations data like vital signs such as body weight, blood pressure and temperature, laboratory data like blood glucose. Again, here on the right-hand side, you see an example of an observation. Implementation considerations. Cloud for Healthcare leverages patient linking, not a dataverse merge. It will be important to both set proper expectations, but to also understand the customer's definition of merge in an EMR. Home health. Communicate the right information at the right time to the right people to provide coordinated home care for your patients. Manage home visits, schedules, notify patients, and give providers access to medical information, even while on the go. With the Home Health app, provider personnel can schedule appointments for the patient based on a variety of factors. Providers can view patient information directly in the context, and a guided business process flow ensures that each measure is taken before and after booking the appointment. Key capabilities of the Home Health include scheduling home visits, enable care coordinators to schedule home visit appointments while viewing patient information directly in context, provider scheduling, view schedules of care team members and optimize visiting routes, home visit coordination, coordinate care and support distinct processes and tasks for the home visit. Patient notification, notifies patients on arrival times and sends follow-up patient satisfaction surveys. Home Health extends Dynamics 365 field service with healthcare-specific capabilities as part of Microsoft Cloud for Healthcare. The Home Health solution within Microsoft Cloud for Healthcare encompasses two apps. The Home Health app is specific to the persona who is scheduling the visit. The app offers the ability to create home health cases and also goes through the process of getting home visits appointments scheduled for the patient. The Care Team Member app is specific to the persona that will be traveling and entering the patient's home to perform the necessary services. This app lets them track individual tasks, views appointment details, and see the full patient view. Home Health extends Microsoft Dynamics 365 field service with healthcare. Health Analytics. The lower two screenshots from the Home Health app. Both are showing the analytics dashboards. The first dashboard shows the analytics that provides a statistical analysis of measurable data for a patient or a care team member. For a specified patient, the analytics dashboard shows a record of vital medical information. People. From the Home Health app, the People sub-area lists home health, patients, and practitioners. From the list of views, you can select the arrow and then select a view, either a listed patient or practitioner. From here, you can then select to open a record. The configurable patient view provides a full view of the following in the context of the patient: patient demographic data, patient clinical timeline, patient care plan development tool, patient care team collaboration tool. Schedule board. With Schedule board, an agent can schedule appointments for the home health patient. Schedule board uses the Universal Resource Scheduling Standard and is based on Dynamics 365 Field Service Schedule board. With Schedule board, you can streamline care with resource management and route optimization tools. You can view the schedules of care team members, and you can optimize scheduling visits with route optimization capabilities in the Dynamics 365 Field Service Schedule board. The Care Team Member App. The Care Team Member App is meant to be accessed directly through the Field Service mobile app. This mobile app provides the ability to see and update the specifics of a home care visit on a mobile device. The Home Visits section on the mobile app allows users to directly access scheduled home visits. From within this view, home health caregivers can view the estimated duration of their home visit and other details. To carry out the home visit, the following details can be reviewed: home visit summary, home visit tasks, patient details, patient signature. The screenshots on the right are examples of how the mobile app would appear for end users. Home health implementation considerations. If a customer is planning to use both the Patient Access Portal and Schedule Board for scheduling purposes, they will need to customize a solution to grab provider slots to avoid double booking. Patient Access Portal scheduling does this natively. URS Scheduling Board does not. Focus on the intent around scheduling use cases. Do they want users to schedule, or do they want patients to schedule their home visits? In addition, it's unlikely that providers conducting vital visits are not the same group of individuals making home visits. Personalized care. Let's take a moment to review the high-level reference architecture for personalized care and patient outreach and patient access. Similar to the architecture for care coordination, we are leveraging the Azure API for FHIR together with the Azure FHIR Sync agent to simplify data synchronization between Azure and Microsoft Dataverse. In this reference architecture, you can see that the patient outreach leverages Dynamics 365 marketing capabilities along with the patient segmentation via Dynamics 365 Customer Insights. Microsoft Cloud for Healthcare Patient Access Portal is built upon Power Apps portals and can optionally leverage the Azure HealthBot as an intelligent assistant. Now let's take a look at the key components for personalized care on the next slides. Patient Outreach. Patient Outreach is a patient campaign management application that helps organize and automate marketing and outreach to patients. Healthcare providers can communicate with their communities and patients in a targeted, efficient way. Providers can use email, text, regular mail, or a combination to provide healthcare information to specific groups of patients and community members. Key capabilities of patient outreach include patient segmentation, which is pre-built patient segments to provide baseline patient cohorts, patient engagement campaigns, create healthcare-specific email campaigns that use pre-built patient segments, event management, use provider event management templates for event administration and registration. The Patient Outreach app enhances Dynamics 365 marketing with healthcare-specific capabilities as part of Microsoft Cloud for Healthcare. Patient segmentation. A segment is a specific group of patients and community members. You can create a dynamic segment or a static segment. Within Customers category, create and manage customer engagement accounts. You can use segments as communication templates and customize them based on other patients and your communication goals. The patient segments use a template based on the HEDIS measure of actions. You can use these segments for a specialized patient and journey campaign, building patient journeys and campaigns specific to your needs. Patient campaigns. Within the marketing execution category, create and manage patient journeys, marketing emails, and social activities. Patient outreach provides email templates that you can customize for your outreach campaigns. Marketing emails. Email is a vital marketing channel for most modern organizations. It's also a core feature of Dynamics 365 Marketing, which provides tools for creating graphically rich marketing emails with dynamic, personalized content. Marketing can send large volume of personalized marketing emails, monitor how each recipient interacts with them, drive customer journey automation based on these interactions, and present results both for individual contacts and with aggregate statistical analytics. Event management. Within the event management category, you can manage the events and create new events from templates or create a new template. You can also manage the event registrations. Some of the core features of Dynamics 365 Marketing include seamless contact registration and attendancy management, all in one place, business processes that guide users through the essential steps of event planning, session track and speaker management, managing attendee passes to grant access to specific session or tracks, venue management for tracking buildings, rooms and room outlets, guest logistics for registering hotels, room allocation and reservations, tracking sponsors and sponsorship for the event, creating Microsoft Team webinars and live events, reviewing the attendee history of each contact, including events and session attended, Dynamics 365 Customer Voice Survey integration, a fully functioning event website that includes self-service attendee registration. Patient outreach implementation considerations. After you deploy the Patient Outreach app, you need to update the Dynamics 365 Marketing data configuration settings. Provide patient with access to their healthcare data, knowledge articles, and in-person and virtual appointment scheduling. Enable patients to chat with a health bot, communicate with a caregiver, and view their clinical data, all within the portal provided by Patient Access. Key capabilities for Patient Access include providing access. Give patients an easy-to-use portal to access their healthcare information. Direct engagement. Enable patients to engage through automated chat conversations that hand off to your patient service center. Scheduling and messaging. Let your patients schedule appointments and send messages to their providers. Patient Access customizes a Microsoft Power Apps portal with healthcare-specific capabilities as part of Microsoft Cloud for Healthcare. Patient Access Portal is utilizing a Power Apps-based solution. In Power Apps portals, each authenticated portal user is associated with a contact record in Dataverse. Portal users must be assigned to web roles to gain permissions beyond unauthenticated users. To configure permissions for a web role, configure its web page access and website access control rules. Portals also allow portal users to sign in with their choice of external accounts. The first time that a patient signs into the Patient Access portal, they are required to update their profile. The patient updates their profile and account information and then selects Updates. To update a profile at any time or to sign out, users can select the user menu to view the profile and account information. Direct engagement. Chat with the doctor or agent. A patient can select the Let's Chat widget, which is shown here in the bottom right-hand corner, and start a chat session at any time. Starting a chat session opens an interactive Let's Chat window. The live chat widget can be routed either to the Microsoft Azure HealthBot service or directly to a patient service agent within Omnichannel for customer service, depending on how the bot is configured. The bot can be programmed to escalate the patient's chat session to an agent or directly to a doctor. The agent or doctor can view the patient detail, the chat history, and search the knowledge articles to help resolve the patient's issue. The agent or doctor must be assigned to a Dynamics 365 as an agent to receive the escalation. Scheduling and messaging. Messages. A patient selects messages to use an email app in Patient Access. Inbox is a list of emails received from care providers. Additionally, this interface allows users to directly reply to messages from care providers. Appointments. Patients can see upcoming appointments and schedule appointments through a set of intuitive windows. A patient can select an upcoming appointment or cancel scheduled appointments. When scheduling an appointment, there are three options. Select instant virtual appointment to seek immediate care with a care provider. Select virtual appointment to book a virtual appointment with a provider. And finally, select an appointment to book an in-person appointment with a provider. Virtual appointment joining process. Patient will select the notifications in the confirmation email. The patient will see the appointment details as well as the Get Started button. They select the Get Started button to begin the check-in process. They then select Verify to confirm the appointment details, and also at this point they can add additional information such as insurance if required. In the Join step, the patient consents to the appointment and then selects the Join queue to join the virtual visit or check-in for the in-person visit. Medical records. Within the Patient Access portal, a patient can select medical records to view their medications, allergies, conditions, visit summaries, care plans, and care teams. Patient Access implementation considerations. Although not technically required, we are finding that customers will also like to have the Care Management app deployed as a minimum to support the Patient Access implementations. Before installing the Patient Access solution, ensure that the target environment will only have one portal of customer self-service type. This will require a Dynamics 365 customer service license. For those customers that are not using virtual visits for scheduling, portal scheduling uses slots and schedules to do the actual scheduling of appointments. The generated appointments show up as an appointment EMR record. Power Automate is used for scheduling and reminders. Please ensure proper licensing and configuration is in place for Power Automate. Scheduling may trigger a large volume of emails. Confirm exchange settings and volumes. Accessibility should be retested if the externally facing UX has been modified. Properly estimate the volume of page visits external users needed and review scaling needed with Microsoft. Patient insights. Let's take a moment to review the high-level reference architecture for Patient Service Center. This is very similar to the previous reference architecture diagrams we have reviewed. In this reference architecture, you can see that the Patient Service Center is built upon Dynamics 365 Omnichannel for customer service capabilities. There are additional Cloud for Health components such as the Patient Access Portal, Patient Insights, and Patient Surveys that can enhance your Patient Service Center experience. Now let's look at the key components for Patient Service Center on the next slides. Patient Service Center key features. Engage with your patients in the way they want by using chat and monitor automatic conversations through the Microsoft Azure HealthBot service. Service agents can help your patients with information and setting up appointments. Key capabilities for Patient Service Center include integration with Patient Access Portal and Azure HealthBot, Patient Service Center itself, productivity pane, agent scripts, knowledge articles. The Patient Service Center builds on Dynamics 365 Customer Service and its digital messaging add-in to add healthcare-specific capabilities to the Microsoft Cloud for Healthcare. Escalation from Microsoft Azure HealthBot in Patient Service Center. Upon receiving the escalation from the Azure HealthBot service, Patient Service Center receives a notification of an incoming chat request within the solution. Upon selecting Accept, you can review the full patient view for the transferred patient or consumer. The configurable patient view provides a full view of the following in the context of a patient: patient demographic data, patient clinical timeline, patient care plan development tool, patient care team collaboration tool. Also, you can monitor the patient conversations. An ongoing conversation dashboard provides information on the conversations that are handled by the agents and integrated bots. Agent scripts. These leverage provider-specific agent scripts to address patient issues. Monitor effectiveness. Conversation Intelligence provides insight to service center managers on agent performance. Follow-ups. Send follow-up surveys on patient satisfaction, reminders on appointments, and more. Appointment and scheduling. Schedule or reschedule appointments during conversations with patients. Agent scripts. Agent scripts provide guidance to agents and caregivers about what to do when they get a patient or consumer issue. The scripts ensure that only accurate, organization-endorsed information is being shared, whilst also safeguarding the organisation regarding issues of legal compliance. Agent scripts help organisations to be unified and effective while also handling patients and customers faster and more effectively. Agent scripts reduce the human errors involved in the process because agents know which actions they need to perform next whilst they interact with a patient or customer, which enables them to adhere to business process. This guidance, in turn, leads agents to provide quick resolutions for the issues and improve satisfaction. Knowledge management. In healthcare, it is imperative to provide patients and consumers with information that will help them make informed health decisions. Through knowledge management in Patient Service Centre, agents and caregivers can proactively send patients and consumers knowledge and wellness content within the context of addressing a patient issue within Patient Service Centre. Scheduling. Scheduling or rescheduling appointments during conversations with patients. The scheduling wizard filters available slots to help you book appointments. Agents can choose whether an email confirmation will be sent to the patient's primary email address. Agents can also reschedule appointments as needed. For example, when creating an appointment, firstly, you would select a speciality or a provider from the patient's care team. You would then select the appointment type, whether virtual or clinic. You would then select the location. Here you can then select the slot for the appointment. Select a date to bring up slots on that date and on future dates. Note that only appointment slots with a status of free will be shown by the wizard. You can then add a reason or more details. The reason field will update the subject field on the additional details field will update the comment field on the appointment. Select whether the email confirmation will be sent to the patient's primary email address. You can then review the appointment details and select Schedule Appointment. After booking an appointment, the selected slot status will change to busy. An appointment record will also be created. A scheduled clinic appointment will have a status of booked. A scheduled virtual appointment will have a status of pending until a meeting link has been generated, after which it will also have a status of booked. Implementation considerations. Patient Service Centre scheduling uses slots and schedules to do the actual scheduling of appointments. The generated appointments show up as appointment EMR records. Power Automate is used for scheduling and reminders. Please ensure proper licensing and configuration is in place. Scheduling may trigger a large volume of emails. Confirm exchange settings and volumes. Virtual health. Let's take a moment to review the high-level reference architecture for virtual health. This diagram is slightly different from the previous reference architecture diagrams we have reviewed. In this reference architecture, you can see that the primary end-user experience in virtual health is within Teams, although still leveraging the healthcare common data model and data interoperability via Azure API for FHIR. Booking of virtual visits appointments can happen either directly from the MS Booking application or via the Patient Access portal. Now let's look at the key components for virtual healthcare on the next slides. Virtual Clinic. Virtual Clinic allows users to access scheduled and instant visits that have been created within the Patient Access portal or through patient scheduling within the Patient Service Centre. Virtual Clinic is a model-driven app that lets users perform the following actions: view dashboards that provide a list of scheduled and instant virtual visits, join virtual visits directly from within a dashboard, access full appointment details in context of virtual visit, access holistic patient view and embedded care management tools during virtual visits. Virtual Clinic dashboards. The Virtual Clinic app provides two separate dashboards. These dashboards allow users to directly access scheduled or instant visits. Both dashboards use a custom code component created using Power App's component framework that provides a view into the virtual visits. These visits have been scheduled in either Patient Access or from within the scheduling functionality in Patient Service Centre. The Scheduled Virtual Appointments dashboard. The Scheduled Virtual Appointments dashboard lets users view a list of scheduled visits. The dashboard view shows the start time, patient, practitioner, and appointment status. It offers a virtual appointment button that allows the users to join the visit. The Instant Virtual Visits dashboard lets users view a refreshed list of patients as they join the queue for a virtual appointment within the Patient Access portal. The dashboard view shows the start time, patient, and appointment status. It offers a virtual appointment button that allows the users to join the visit. Implementation considerations. The EMR connector provides connectivity from Epic to Teams in order to schedule a virtual visit in Epic that leverages a Teams meeting. Ensure requirements map the scheduling journey from start to finish. There are multiple paths available for scheduling. Patient access self-service scheduling in Dynamics, MS booking scheduling, EHR scheduling initiated from Epic or, soon to be included, Cerner. It is currently not possible to embed Virtual Care app within this launch window of a Microsoft Teams meeting. Embedding within a Teams chat outside of a channel doesn't persist the form that the user was viewing. Data interoperability. The healthcare data model. Microsoft Cloud for Healthcare offers a comprehensive set of solutions for the healthcare market, bringing together capabilities from Microsoft Dynamics 365, Power Platform, Microsoft 365, and Microsoft Azure. Microsoft Cloud for Healthcare expedites a healthcare organization's ability to roll out solutions. Partners and customers can further extend the cloud for healthcare to meet the needs of organizations. Healthcare data model. The healthcare data model for Dynamics 365 is based on the Fast Healthcare Interoperability Resources, known as FHIR, standard framework, Release 4. Microsoft is making it easy for partners and customers to create new use cases and workflows without redefining the healthcare data architecture. The FHIR-based model makes implementations for healthcare customers easier, quicker, and more secure. Learn more about FHIR Standards Framework at hl7.org/FHIR. Due to the many advantages FHIR offers, FHIR is widely used around the world, and implementation community is growing quickly. The healthcare data model is already included in Microsoft Cloud for Healthcare solutions. It's also available as a standalone option for partners and Dataverse customers in the Microsoft Cloud Solution Center. Healthcare data landscape. Patient-physician information. This represents the patient record. These records need to be acted upon and exist within Dataverse. Data updates should flow back to FHIR EMR. Non-clinical data. Non-clinical data accrued through interactions with the patient typically would occur in the system of engagement. This data never goes to FHIR or EMR, e.g. marketing, customer journeys, phone calls, cases, chats, etc. Managed clinical data. Clinical data that Dynamics participants in the creation of update of care teams, care plans, appointment scheduling are all examples of this data. This data needs to exist in Dynamics. Data update should flow back to FHIR or EMR. Referenced clinical data. Clinical data that needs to be viewed in Dataverse. This data typically has a high number of transactions. This data does not need to exist in Dynamics, e.g. medications, observations, encounters, etc. The FHIR agent. The FHIR agent is a data synchronization solution between the two data service platforms, Azure API for FHIR and Microsoft Cloud for Health. Azure API for FHIR and Dataverse are two different services from Microsoft. Azure API for FHIR uses flexible data structure and Dataverse uses relational data tables and columns. To address this challenge, FHIR agent has been developed for a seamless integration. FHIR architecture. The FHIR agent does not interact with any electronic medical records (EMR) system directly. The FHIR agent does not read data from an EMR system and does not write data to an EMR system. Instead, the Azure API for FHIR is responsible for data ingestion from an EMR system and data write back to an EMR system. Azure API for FHIR enables rapid exchange of data through FHIR APIs, backed by a managed platform as a service, offering in the cloud. It makes it easier for anyone working with the health data to ingest, manage, and persist protected health information in the cloud. The FHIR API and compliant data store enables you to securely connect and interact with any system that uses FHIR APIs. FHIR agent administration. The FHIR agent includes a baseline set of mappings that represent the minimum amount of FHIR data needed to enable features within the Microsoft Cloud for Health solutions. You can enable, disable, and modify these maps as needed. The mapping framework is extensible, and you can configure it to include additional FHIR data that's representative of your organization's scenarios and use cases. FHIR agent administration includes 22 entity maps and 360 attribute maps. Customers have the ability to update and create entity and attribute maps as necessary. Implementation considerations. We support versions 4.0.0 and 3.0.1. The implementation of the FHIR standard is based on the US Core Implementation Guide, which defines the minimum mandatory elements, extensions, and terminology requirements that must be present. US Core is a loadable profile. As we deploy in other locations, we will use profiles that align with the country-specific regulations. FHIR service and FHIR sync agents do not need to reside in the same tenant as Dataverse. In the sync agent setup, you specify the CDS tenant ID. However, you do have to have an app registration in the same tenant as CDS. Creating patients in Dataverse is not a flow that the FHIR sync agent supports. The patient should first be created and onboarded in the EMR system. The new patient created in EMR then flows to the Azure FHIR server and then flows to Dataverse. Confirm if codable concepts is being used. This is not integrated, but an initial load from the FHIR standard is in place. Customer admins will need to update the codable concepts as necessary. FHIR mappings and codable concepts are data configurations that will need to be part of the solution deployments. Estimate the throughput needed for the data load and review scaling needed with Microsoft. Plan for multiple dry runs of the initial data load. Getting started. Cloud for Health Docs homepage. Please visit docs.microsoft.com/industry/healthcare for further documentation around how to get started for Microsoft Cloud for Healthcare, how to buy Microsoft Cloud for Healthcare, and how to set up Microsoft Cloud for Healthcare. In addition, there is videos and learning resources, as well as enhanced patient engagement demos and how you empower the health team collaboration. Please visit Industry Healthcare Overview for more details on licensing, support, deploy, configuration, and use cases. The Solution Center. Please visit admin.solution.dynamics.com. Here you will be able to navigate to the Microsoft Cloud for Healthcare. From here, you can select all in the filter by capability drop-down to view all available solutions. Select Add all healthcare solutions to deploy all solutions. Select Quick View to learn more about the component and its dependencies. Select Add to select one or more solutions for deployment. Solution concepts and solution layering. When you install Cloud for Healthcare, it's important to be aware of the solution layering and required components. Solution layering is implemented at a component level. When multiple managed solutions are installed, the last one installed is above the managed solution installed previously. This means that the second solution installed can customize the one installed before it. When two managed solutions have conflicting definitions, the runtime behavior is either last one wins or a merge logic is implemented. The first layer is the Healthcare Foundation package. This is a combination of both configuration, data, and solutions. Next is the Team Collaboration package, followed by FireSync Administration package, which is also a combination of configuration, data, and solutions. The last install is the Cloud for Healthcare Application Capability package. Optionally, you can install the Sample Data package. Anything you build will sit on the top of these layers. Let's take a look at the sample solution delivery model. Solution delivery model. Here you can see that the Microsoft Platform Data Model and Industry Solutions sit in the bottom layer. As a system implementer, you may choose to leverage an ISV solution, either industry or horizontal, to extend the baseline Cloud for Healthcare solutions. You may also choose to implement a solution from the Azure Marketplace. In all of these scenarios, your unique solutions customized for the deployment will sit on the top layer of solutions. Environment planning. Define environment needs based on your ALM strategy. Environment planning is extremely important when you start determining your storage needs. Most customers create environments on the fly, not thinking of the impact that it has on their storage entitlements. Doing so creates opportunities for them to go over their entitlements, which will cause them to face enforcement. These enforcements could limit their ability to deliver on their CI/CD strategy. As such, environments planning should be defined based on your ALM requirements. Resource planning. You will need to identify an internal product owner for the solution and its entirety. Having siloed owners, Azure owners versus Power Platform owners, can lead to misaligned strategies. For implementation, you will need support from your global tenant admin, Power Platform Dynamics 365 system administrator, and an Azure administrator. Business stakeholders should be engaged from the onset of the implementation, including EMR, EHR stakeholders who may drive conversations related to integrations. Crawl, walk, run, fly. Cloud for Healthcare is a multifaceted platform. Systems implementers should be breaking requirements down into customer user stories to deliver incremental value to customers' business and not working in traditional waterfall projects. An agile project methodology is recommended for building layers over time. Implementation considerations. The total cost of ownership is more than just a licensing SKU. You will need to plan for Dataverse storage capacity, API entitlements, and Azure consumption. Security reviews and approval should be accounted for and planned in the project workshop plan schedule. Review security and regulatory requirements around data transmission, storage, processing, data encryption, and decryption applicable to your implementation. There are no persona-based security roles provided in the solution. Customer will need to determine their own security needs within the application. Performance testing is recommended to be part of every implementation. Ensure proper monitoring and alerting is in place for the operating of the solution. Resources. Here is a list of additional resources you may want to visit. On the Learn site, we have a specific module for the Microsoft Cloud for Healthcare. We also have the Microsoft Cloud for Healthcare documentation that I've previously mentioned. We also have Microsoft industry blogs. And importantly, we also have a dedicated tech talk on the FireSync agent, which is linked here.